Before Katrina, we didn't have an adequate healthcare delivery infrastructure in terms of mental health, but we did have 358 inpatient beds. More than 100 of those beds were at Charity Hospital at the Crisis Intervention Unit. Now in New Orleans we have 70 mental health beds. Before we had 358. And it's a lot worse because of the widespread incidence of mental health challenges related directly to the disaster and the struggles that people have had to fight since then. Post-traumatic stress disorder, substance abuse, self-medication, chronic depression, anxiety. So all of these things have really exacerbated what was already a difficult circumstance, and it's fair to say that this can only be described as a mental health emergency, not a crisis, but an absolute emergency. Our rate of suicide in New Orleans is more than 2 times the national average, and our rate of attempted suicide is more than 3 times the national average. So we have literally thousands of people who are suffering severe mental health conditions who are undiagnosed and untreated. One of the primary problems that people face are the disintegration of social networks that supported them before Katrina. Churches, neighbors, neighborhood schools, all of the social networks that supported people when they faced emotional difficulties and challenges have effectively been disintegrated by the flood that followed the storm. Where you might have had a neighbor or a relative or a close friend or maybe a minister or a social worker affiliated with a church who you could talk to, or at least knew they were there if you needed to talk to them, in lots of cases it's no longer there. And practically speaking, people are facing very difficult circumstances. Thousands of people are struggling to rebuild their homes. It's very difficult to find affordable housing. Rents have increased anywhere from 30 to 80% since Katrina. So people are dealing with these practical problems of rebuilding and returning, in addition to the anxiety occasioned by the disaster for the people who actually lived through it, and even for the people who did evacuate, who saw the terrible struggle that their neighbors and relatives and friends went through. We really need an affirmative and active commitment from the federal government. Our local leadership has miserably failed on the issue of restoring our healthcare delivery infrastructure, miserably. And without an aggressive commitment from the federal government to restore our healthcare delivery infrastructure, especially mental health, we're going to continue to suffer. And I dare say, if some of the decision makers in Washington had to spend a month living under these conditions and talking to people who suffer every day, that commitment would probably be forthcoming very soon.